Welcome everybody to another Kansas State Veterinary Diagnostic Laboratory webinar. My name is Greg Hanselcheck and I'll be your moderator again today. As usual, we have a little housekeeping thing to talk about before we get to our special guest. One is if you, excuse me, if you stay with us the entire webinar, we will send you a certificate for 1 hour of continuing education within the next 7 to 10 days. Number two, please fill out the survey that we'll ask you to fill out after the webinar. Input from you is very, very important to us. Three, if you have questions during the webinar, please put them in the chat and then we'll have our special guest answer those at the end. And then the last thing is our webinar series will continue starting in January, and some of the topics that we'll have, we've got a presenter about the newest things on rabies. We've got the second edition of common backyard poultry diseases. And then we've got another one on how to read antimicrobial susceptibilities, which is a hot topic. So those are coming up in the spring. So it's my great pleasure to introduce today our special guest, Dr. Jeba Chelladurai. Pretty close, I hope, to the pronunciation. Jeba's on faculty here at the College of Veterinary Medicine. She's been with us since 2020. She received her veterinary degree from Chhattisgarh University in India, and then did a master's at North Dakota State, and then a PhD at Iowa State. She's got the special skill set. She's board certified by the American Academy of Microbiology, and it's both in immunology and parasitology. So Jeba does a lot of teaching. She's got a lot of research interests, particularly in canine internal parasites, and then something close to my heart, she also likes to do research in bovine strongyle. So we're very, very grateful to have Jeba here to talk about some internal parasites. So with that, Jeba, I welcome you and I'll turn it over to you.
Thank you, Dr. Hanselcheck. Good afternoon, everyone. Thanks for being here. So today I'm going to restrict my talk to the diagnostics that are offered here at the KSVDL's Parasitology section. If you've seen my name, I'm one of two parasitologists, so if you use us for your testing, you would have probably seen my name or my colleague, Dr. Brian Hedden. But for today, we'll focus on the test choices offered at the KSVDL and really how to interpret them. So first off, we want to start talking about why we would want to do parasite diagnostics. So one of the main reasons why would be to figure out if a patient in front of you is infected with a parasite or not. Very often, we have patients that are completely asymptomatic, that if you actually run a parasite test, you would find parasites. So some healthy patients need parasite diagnostics for just common parasites that may be found. Some sick animals have some rare parasites, and that might be a reason why you would want to run a parasite diagnostic test. Very often in clinical practice, especially if you have a large animal that looks wormy, you might want to confirm a presumptive clinical diagnosis where you think the animal's wormy and you might want to run a parasite diagnostic test then. In herd situations, and we are really talking here about targeted selective treatment, you might want to determine which of these animals in a herd might need treatment and might benefit from treatment. Prior to that, you might want to do some parasite diagnostics. And then again, we want to understand if the treatments we are using, our dewormers, are efficacious. If they're not working, we want to move to another drug class potentially, and so parasite diagnostics are the way to go about that. And then often in our small animal practices, we have infections that can be zoonotic, such as Toxocara or hookworms. So we want to know if the patient in front of us is infected and if that patient is contaminating the environment that it is living in. So for all these reasons, you might want to do some parasite diagnostics. There are many, many tests offered, and you can use a variety of tests to get to the same diagnostic result. However, not one technique fits all your needs, and often your needs might be figuring out what the parasite burden is in a specific animal or in a herd. And sometimes in our small animals, we want to specifically know which parasite is causing the infection so we can specifically treat it. Again, coming from a One Health perspective, we want to know very specifically what the parasite is. And so here in the KSVDL, we offer a lot of diagnostic tests, and our goal here today is to help you determine which would serve you the best. So to start off, I want to say when you do send us samples, please give us the signement and case history, and this will help us serve you better because we can help you, help channel your needs towards a specific test. So we'll start off with some of our food animal parasitic diagnostic tests because that's what is listed first in our title. And so here's all of the tests we offer for our ruminants, right? So if you look up at our catalog, there's a lot of choices. And so our question really is, which one should you be choosing? So we'll go through these in the order that you are likely to select, and that would be most beneficial to a herd of food animals. So we'll start first with our qualitative fecal flotation. This is a test that is offered in our diagnostic lab, but if you want to do it in your clinic, you can do it as well. But here at the KSVDL, we offer a semi-quantitative test. So we take samples that you send, and we will do a double centrifugal flotation. So we will sediment it first in water and then float it up with a Sheether sugar solution. And some potential results may look like this. If there is a positive result, we will kind of semi-quantitatively tell you if we saw a few parasites on the slide, so that might be a 1+. Here in this example, we have Eimeria zuernii, which was seen in a bovine, and so that might be 2+, so that might be maybe it was 10 oocysts on the entire slide, and that might be a 2+. So our positive results will look like this, and if there are no parasites seen, we will say no parasites seen. Now, you might want to select this test very specifically in a food animal case if there is unknown history, if an animal has been newly introduced into a herd. This might be the first test that you would start with. With this, you can confirm the presence of strongyle type parasites or Eimeria oocysts, which are coccidia, and any other oocysts like tapeworms that are being shed. Often this is the test you would use to confirm if parasites are the cause of diarrhea or if you should be looking for a viral cause, right? So this will help you rule out parasites as the cause, and it's a great test to choose for that. So when you do send samples, again, we're doing it as a semi-quantitative test, and you're going to send us a fecal sample, and we ask that you send it in a leak-proof container so that it doesn't spill. Sometimes gloves break open, especially palpation gloves that are tied up. So we ask that you send it in a leak-proof container. So some of the parasites that we do see in these tests are the strongyle types, which are in a box here. So there is no differentiation between the various types of strongyles that we may see. So Haemonchus eggs would look very much similar to Osteithegia eggs or Couperia eggs. So we group those together as strongyle type eggs. We also will tell you if we saw Eimeria, and other than Eimeria bovis and Eimeria zuernii, which are the most pathogenic coccidia of bovines, the rest of the Eimeria are reported out as Eimeria oocysts. But again, in the result, we'll see 1+, 2+, 3+, or 4+, depending on what we see on the slide. We also can see some bipolar eggs like Trichuris. Sometimes we see tapeworms as well. Now, that might be a good starting point for a diagnostic test, but if you know that strongyles are the problem, or if you're suspecting coccidia as the problem, you might want to try to do, so we'll just skip this and come back to it, but we can do a quantitative test. Again, you can do this in the clinic or in our diagnostic lab. And so here we are going to quantitate the number of eggs per gram. So the result might then look like this. So say you had a strongyle infection, that might be strongyle type eggs, and then we'll have a quantity. So for example, we have 340 eggs per gram. And then if you have a negative result, if we did not see any eggs in our quantitative fecal float, we might say we had less than 10 eggs per gram of any kind. And the reason for that is that we have our test set up is in such a way that if there are less than 10 eggs per gram, we will not be able to detect it, and so that is our analytical sensitivity. So you can select this test if you want to screen for the efficacy of an anthelminthic or dewormer. So say you've been drenching cattle with a specific dewormer, or you've been using a poron, and you want to know if that works, you can select this test before treatment and then after treatment, which is known as a fecal egg count reduction test. Otherwise, you can just do a post-drench count, and so that will help you determine if your treatment actually worked after you had done the treatment. And then this is a great test if you are testing new animals during quarantine, especially if you suspect that they came with a strongyl burden. This is a great test to use. Additionally, you can use this to kind of determine if your pasture, if it's a cow-calf operation, if your pasture is contaminated with strongyl type eggs or Eimeria. Again, this will give you a quantitative test. Again, we want to target treatment to avoid resistance, and that is our recommendation in the future. And so to know which animals you want to treat, a quantitative fecal float will give you the best idea of what you can use. Now, we can do a pooled fecal float if you send us maybe 10 samples and you write it on the request form and say, we want a pooled sample. We can pull it here for you at the KSVDL and run this quantitative fecal float. When you do get the results, we want to learn how to interpret these. And in the past, we did not have guidelines for interpretation. And so these guidelines were just released in February 23. And so this is what they say. So if you have sheep that you're testing and you've done a quantitative fecal float and they found strongyl eggs, if we have between 50 and 350 eggs per gram, that's a very light infection. And the recommendation is that we do not treat those animals. Now, if you have between 400 to 600, which is a moderate infection, treatment may be necessary. But again, if you can skip it, you can. But if the animals have between 600 to more than 1,000, it's a heavy infection and treatment is absolutely necessary. Again, sheep tend to have clinical signs as your egg burden goes up, because that is reflecting the presence of more and more parasites within the animal. Now with cattle, our guidelines are a little bit different. And again, in the northern states here and kind of in the middle prairies, we do not see heavy infections in cattle. So very often we see less than 50 eggs per gram, and the recommendation is that we do not have to treat these animals. In the past, we would have said you treat any animal that had a strongyl infection, but because parasite resistance to dewormers is so rampant, our current recommendation is that you do not treat these animals. Between 50 and 100 eggs per gram, it's again a light infection, and unless your animal is showing clinical signs, you do not generally have to treat. But you as a veterinarian get to decide if that animal really needs treatment. So you're going to look for clinical signs, signs of weight gain. If the animal's gaining weight and it's looking all right, then with this 50 to 100 eggs per gram, you do not have to treat. Now, when we get into the 100 to 200 eggs per gram range, we are talking about a subclinical infection where the animal may be losing weight. And unless you weigh the animal, we will not know that. But in that range, the animal may benefit from an anthelmintic treatment. Again, we're looking for an effective anthelmintic that can be used in that animal or in that herd. Now, about 200 eggs per gram, which is kind of rare in these parts, that is clinical parasitism. Treatment is recommended for those animals. Now, again, these are just recommendations, and you as a veterinarian get to decide if a given animal needs to be treated or not. So again, these are for individuals. So with pooled samples, we have to take clinical signs into consideration and then decide if an animal needs treatment or not. We'll go back to our Cryptosporidium float. I apologize for skipping that. Now, a Cryptosporidium float is a special kind of float that we offer here at the KSVDL, and so the results may look something like this. If we see a positive result, we're very specifically looking for Cryptosporidium, but also for other parasites in this case. We will say if oocysts were found, we'll report that. But if other parasites are found, and very frequently we see Eimeria in the Cryptosporidium floats, we will also report those. Now, we would recommend that you only select this test if you're trying to diagnose parasitism in a young calf that is less than 30 days old and that has diarrhea caused by Cryptosporidium. In animals that are a little bit older than a month, Cryptosporidium is not very likely, or at least Cryptosporidium parvum is not very likely. And in that case, we would recommend that you use a qualitative fecal float or a quantitative fecal float, especially if that animal has been put on pasture. Then a qualitative or a quantitative test would give you better results than just the Cryptosporidium float. Now again, we want to emphasize that Cryptosporidium is zoonotic. And so for both your sake as a veterinarian and for the people working on the premises, we would like you to kind of convey that information to the owners. So quantitative fecal floats, here's our interpretation. Now there are some special tests that are also on offer. And so one of the words that you might see on our test catalog is the Behrman test. Now the Behrman test is a test done on feces, and we are looking for larval stages like the one that we see in this picture. We are relying on the motility of the larvae and really that the fact that it swims in water, but then that it cannot fight gravity is the principle behind the test. And so we set up this Behrman test, and the larvae that are present in the feces move out of the fecal pad into the water, and we look at the water later on after 8 hours to look for the larvae. Now results may look like this. Dictyocollis is the cattle lungworm, and if we see the larvae, we might say Dictyocollis larvae seen. Often we see free living larvae, and so in that case you might see no larvae seen, as in no parasitic larvae seen, but in the comments we would say free living larvae were seen. Right? So we would recommend that you pick this test though only if you're suspecting lungworms in food animals. And so in cattle, Dictyocollis viviparus is the large lungworm, and that is the only larvae we expect to see in the feces of cattle. That is fresh feces from cattle. If you get feces from the ground, often we see those free living larvae. Now, one of the points to remember if you're sending in a sample for a Behrman test is to not refrigerate the feces, because the larvae then would stop moving. And the whole test relies on the larvae moving out of the fecal pad. So we recommend that you don't refrigerate the feces for this test. Another special test that we again offer is the sedimentation test. And this is a test done on feces where we add water and we mix it up and we let the slurry sit so that all heavy things settle down in a tube. And so the results of this are typically for heavy eggs, such as the liver fluke egg, which is known as fasciola. So for an example positive result, you might see something like fasciola eggs were seen. And then if we didn't see any eggs, we will say no parasites. Now, one caveat here is that we sometimes see strongyle type eggs in sedimentations, because strongyle type eggs also have some weight and they settle down in our sediments. And so sometimes you might have a positive result where we see a strongyle type egg, but it's not a fluke egg. So depending on what the sample has, we will have your results written out as positive if there was any parasite at all seen, and negative if no parasites were seen. Now, we recommend that you select this test if you are suspicious for Fasciola hepatica. And we've had a recent increase in the reported cases of the liver fluke around Kansas. And so here in the next few months, we'll be doing a study through the KSVDL to look for liver flukes, and we recommend that you enroll some farms that are in your practice range. Now, you would be suspecting liver flukes if you are seeing weight loss and ill thrift in cattle, and using diagnostics, you find that strongyles are not the problem. There might be other bacterial or viral causes, but if the cause is not bacterial, viral, or strongyles, then you might suspect fasciola. Again, flukes and animals that are in pastures with standing water may be at a higher risk for Fasciola hepatica, and so in that case, we recommend that you run this test. When you do run this test and you're sending us feces, we recommend that you send as much feces as you are able to, so that if we need to repeat the test, we would have enough feces. Now, there are also some adult parasite ID or parasite ID, which is a test that we offer, where you can submit any adult parasite that you see or any other interesting parasite that you may see, which might include worms, tapeworms, flukes that you may see at necropsy. Maybe you saw ticks or mites or lice on cattle or sheep. You can submit those, and then maybe fly larvae or maggots that you want identified, you can submit those as well. Now, for this, you do have to submit a parasite. Often we have people check off this box when they are wanting an ID for our fecal flotations. So when we do check the fecal flotation, we would do a qualitative or quantitative, and we will tell you the ID of the eggs we see in the sample. But if you're selecting this, we recommend that you do submit an adult parasite. So here on the right, we have some pictures of the common ticks that we have around here. And again, we want to remind you that Haemophysalis longicornis, which is the invasive Asian longhorn tick, is coming in, has been reported in the US, and we are on the lookout for it. So if you do see ticks that you've never seen before or that look odd, we recommend that you send them to us so we can ID it, so that we know of its presence in Kansas. All right, so just to summarize our tests for ruminants, we ask that you do send us some signement and case history if you are sending a sample so that we can serve you better. And if you need a change of tests, we can recommend that you change the test that you request if we have a good history and signement. So very often it is very helpful to know if an animal, say a cow, is on pasture or if it's on a feedlot, because then it changes the type of eggs that we are looking for in our feces. In animals that are that have an unknown history, so say you are you've been invited to a farm that you've never been on before, or maybe it's a new animal that has been added to a herd or flock, we recommend that you start with a combination of qualitative or quantitative, or at least a quantitative if you know that Strongyle parasites are the problem. And so you can use that information to then better help the client who has the animal. In herds of flocks with known history, we recommend that you use a quantitative test. You can use it again before treatment to select the animals that need to be treated, or you can use it after treatment to see if a dewormer that you've used is effective or not. You can also do that formal FECRT that I mentioned, where there are resistance problems, which would involve sending 2 different samples 14 days apart. So on day 0, when you are treating, you would send the first sample, and then 14 days later, you would collect samples again and send it in for a quantitative test. And so then from there, we can calculate the fecal egg count reduction test results. And for an effective dewormer, we expect that to be around 90%. You can also request pooled FECs if you can pool them on the farm or in your clinic. That is great, but otherwise you can make a request on the test form in the history box, and we will pool them together before we do our quantitative tests for you. Again, the other tests, such as the Behrman and sedimentation, are special cases, not something routinely used unless you are suspecting lungworms or flukes on a given premises. Now, moving on to tests for equines, we do not offer too many tests because Strongyles really are the problem in horses, and they have 1 species each of an ascarid called Parascaris. They have pinworms, they have 1 tapeworm, and they have 1 Eimeria. So really all of our focus is on the Strongyle type parasites for horses. Now, we offer that qualitative fecal flotation, which is again a centrifugal fecal float. Again, you can do that in your clinic if you would like, but here at the VDL we offer that. And results may look something like this. If we see maybe an ascarid type egg, we would do a semi-quantitative result with number of kind of eggs that we see on that slide. So something like Parascaris eggs, 2+, might be what you see on your report. Now, we recommend that you select this test. Again, if the animal's history is unknown, if its deworming history is unknown, or if you're suspecting Strongyle eggs and other parasites that are being shed. Please send a handful of feces and we can do this test. So I want to just show some of the common parasites that we do see in this test. So on the right, we have the eggs that we commonly see, including the Strongyle type eggs, the pinworm, the ascarid type egg, and the tapeworms. Now, Strongyle type eggs in horses come from 2 sources, either large Strongyles, which are our classical ones like Strongylus vulgaris, which are highly pathogenic, and the small Strongyles or cyatostomins, which are more common. Now, because of rampant deworming across the field, we have killed off most of our large Strongyles, And for the most part, all of our strongyles that we see in practice are small strongyles. So we are trying to quantitate them with our quantitative tests if we do know that those are the problem. But in a younger animal, again, a newborn animal, you might want to consider doing a qualitative test just to see if ascarids predominate or strongyle types predominate. Now, animals with known history of strongyle problems, you can do this quantitative fecal float. Again, we are quantitating the number of strongyle eggs per gram of feces, and our sensitivity, again, is 10 eggs per gram, and anything less than 10 eggs per gram, we will not be able to detect. So select this test if you are looking for strongyle type eggs, or if you're trying to do a fecal egg count reduction test to understand if your dewormer is working or not. And so some interpretation points here, and this comes from the AAEP, or the American Association of Equine Practitioners. They recommend that you only treat a specific group of horses, and for that they recommend doing these quantitative fecal floats. They recommend that you classify animals into low shedders if they are shedding less than 200 eggs per gram, or moderate shedders if they are shedding between 200 to 500 eggs per gram, or high shedders if they are shedding greater than 500 eggs per gram. And they recommend that you treat low shedders once or twice a year, and then the moderate and high shedders three or four times a year. And this recommendation, again, it can be visualized in greater detail on the AAEP website, and we recommend that if you're in equine practice that you kind of follow their recommendations. Now, if you're doing an FECRT, again, we expect efficacy to be ideally around 99% for all of our drug classes. But if you have a FECRT of 90% or less, and this is 95% for the ivermectin, moxidectin group of compounds, that means that your dewormer is, the parasites on your farm have resistance against the dewormer that you're using. So these are some important recommendations that are to be given to the producer or owner after the diagnostic test is done, and really to recommend that they follow the gold standard of the AAEP. So those are our two major tests that we do for horses. And with that, we come to the end of our large animals, and we'll move on to our small animal or companion animal tests. So again, we offer a whole variety of tests for companion animals, for dogs and cats specifically. And here's how you would select between these tests. Now, we do offer the direct fecal smear, which are better done in clinic than in a diagnostic lab. But if you do it in your clinic, this is how you would do it. You would start with a small amount of feces, you would put it on a slide, and then put a drop of saline, mix it together, and put a cover slip, and then look at it under a microscope. If you see something that is moving, the result that you see is valid, but if you don't see any parasites, the test result is kind of inconclusive. So we are only going to recommend this test if you're looking for very delicate parasites such as protozoa and trophozoites, and that might be like a Giardia trophozoite in an animal that has giardiasis. The test only is good for motile forms, so if something is moving, they're easier to visualize. And this might again include Giardia trophozoites, things like amoebae and nematode larvae. This is a test that we again recommend for smaller animals, including our exotics and amphibians, or animals that just produce a small amount of feces. If you are sending it into our diagnostic lab, please do not refrigerate the feces, because again, once refrigerated, all of these parasites stop moving, and we will not be able to see them in the lab. This, again, is not a very sensitive test, but if you do it in your clinic, this is what you would expect to see. So on the left here, we have Giardia trophozoites, which have that very characteristic falling leaf type of motion. And so you see how that trophozoite is trying to fall. It doesn't move that much, and so that's kind of why it has that motility. On the right is a rarer parasite that we see in felines. It's called Trichomonas blackburni, and those trophozoites have a jerky motion, and if in a direct smear, you can sort of see them move. However, the test that we usually recommend for our companion animals is the qualitative fecal flotation, which here at the KSVDL, we do a centrifugal double flotation where we, again, use the centrifuge to do our testing. This is far superior to the passive or benchtop float that is typically performed in clinics. If you are performing a centrifugal fecal float, you can choose to do it in clinic or in the diagnostic lab. But the benefit of the centrifugation is that you concentrate all of the eggs in the feces into a small cover slip, and then you can examine that. Whereas in a benchtop float, you do not have the benefit of gravity and the benefit of centrifugation combined together. And so the centrifugal fecal floats have been shown to be more sensitive than the benchtop float. And so that's what we do here at the VDL. We do our tests typically in Sheether's sugar, which is a solution with a high osmotic potential and high specific gravity. So all of our light eggs flow to the top. And so here are some eggs that we typically see in canine and feline fecal floats. So we see roundworms very commonly, hookworms, which look like strongyle type eggs. We see a variety of bipolar eggs, and those might be either whipworms or they might be lungworms, which produce eggs. So we also see some protozoa like Giardia, but because of the high osmotic potential of the solution, we see that Giardia cysts collapse. But when they do collapse, they collapse in a very specific way. And so here we have that picture on the left. I want to just point out that there are some lungworms that produce eggs that are better diagnosed with this test than with a Bayerman. And so again, in a coughing dog where you're suspicious of lungworms, we recommend that you pick this test. Now we do offer, we'll go back to the results here. So if you do see positive results, we will identify the parasite and give you a sort of idea of how many we see on the cover slip that we've used. So an example might be Ancylostoma caninum, which is a hookworm, so that might be 1+, 2+, or 3+. Sometimes we see things that we don't expect to see in canine or feline fecal floats, like coccidia of ruminants, right? So we then might say we saw imedia in your fecal float due to coprophagy, and that result might just come in the comments. So we recommend that you just select this test as a routine test for roundworms, whipworms, and hookworms to diagnose tapeworm eggs or even protozoan oocysts, but with that understanding that Giardia cysts tend to collapse in this sort of sugar float, but then they collapse in a very specific way. Some points to remember are to send at least 5 to 10 grams of feces and more if possible again to ensure that we can repeat the test if we need to. A special kind of float is the Giardia float that is offered. So this is very similar to the float that I just described, except the flotation solution we use is zinc sulfate. And so when we see cysts, this is what they look like. So here on the left, we have the Giardia cysts in zinc sulfate, and it's been stained with Lugol's iodine. This flotation solution ensures that the cysts don't collapse, and they are very easy to spot, whereas in Sheether's sugar, which is unstained, they do collapse. We recommend that you pick this test if you are suspecting Giardia in a companion animal, and you can maximize all of the information that you can get if you combine a Giardia float with a qualitative fecal float. A properly performed zinc sulfate float is as sensitive as the SNAP test, which is also another test we offer here at the VDL, but you can also do this in your clinic, where we are looking for Giardia outer cyst wall antigen in the feces. And so this test is exquisitely sensitive, and even if you have a few cysts, you might detect it with the SNAP test. Now, we also offer a quantitative fecal floats for companion animals, but it has only been validated for hookworms. So we have a lot of resistance in hookworm populations around the country, and often we see wall-to-wall of hookworm eggs, something like we see in this picture here. And so we want to count the number of hookworm eggs in your sample. And so for this, our results may look like just like any other quantitative where we quantitate the eggs per gram of feces. So we follow a similar protocol to the ones described in food animals, and our sensitivity is 10 eggs per gram. So anything less than 10 eggs per gram, we will say less than 10 eggs per gram detected. Now, because resistant hookworms are a big problem, if you have infections that are persistent that will not go away with multiple treatments, we recommend that you call us so that we could talk to you and work through this problem together with you. Because resistant hookworms have been showing multiple drug resistance to many different drug classes. And so one of the ways to kind of work through a case would be to use this test multiple times and to do a fecal egg count reduction test, which is a very standard formal test, where we do a quantitative test on day 1 or day 0, and then we treat, and then follow it up with another quantitative test 14 days later. Now, we want you to remember that the pre-patent period and the life cycle of hookworms can be very short as 14 days. And so if you delay anything in your FECRT, then we could be detecting reinfection instead of resistance. And so we want to work together with you to do these tests so that your patient may benefit from the use of diagnostics and the use of the treatment that is being given to it. All right, so some special cases with our small animals, again, is the Behrman technique, which is offered here. Now, we have 4 different parasites in dogs that make larvae and 1 parasite in cats that also make larvae. Of these, Strongyloides stercoralis is something that causes diarrhea, and then Crenosoma might be an example of a lungworm that is seen. However, Crenosoma, or the fox lungworm, is a very rare parasite here in the middle of the country. And so we recommend that if you're looking for lungworms, that you start with a qualitative test first, and then in a special case where we see larvae in a qualitative test, we may call you up and say, can we do a Behrman on this sample? Now, Strongyloides stercoralis causes diarrhea that will not go away with antibiotics. And so for diagnosis of strongyloides, this might be a technique to use. Another special technique is the fecal sedimentation. So again, we have small animal flukes like Heterobilharzia visualized here that may make eggs that are very heavy to float. And so these are best tested using a fecal sedimentation test. And so results may look like this, where if you are if we have results from a positive case, we might say Heterobilharzia or Alaria eggs seen. And so we only recommend that you select this test if you have some suspicions for fluke eggs, or if you suspect that the animal may have Taenia type tapeworms, which do not float very well. Now, I want to briefly mention the availability of coproantigens and copro-PCRs, which are offered by different diagnostic labs out there, including IDEX labs, which offers antigen tests, and they often combine them with qualitative fecal floats. Now, these have the ability to diagnose parasites in the pre-patent period, and sometimes the antigen is detected before the eggs. So even though we don't offer this test, if you have trouble interpreting these tests, please call us and we'll help you through the case. There's also copro-PCR tests that are offered through Antec labs, and there again they're looking for the presence of DNA for several different parasites. They also offer fenbendazole resistance detection in hookworms, and you can detect zoonotic assemblages of Giardia. The only problem here is that the sensitivity has not yet been published, and so before we recommend any of that, I would recommend that you make your choice for your patient. So finally, we want to just wrap up with our heartworm tests that are offered for companion animals. We offer both antigen tests and microfilarial tests. So the antigen test we use is called the DiroCheck, which is a well-based ELISA. We recommend that you use this test in addition to your SNAP test that you may run in clinic to confirm infection, Or if you have an animal that has that you are very suspicious of heartworm, but the antigen is negative, then we recommend that you use a heat treatment antigen test, and we can run both of these here at the KSVDL. The sample for this test is serum, and it is a very highly sensitive test that can supplement your own diagnostics in clinic. And finally, the microfilarial tests, what we offer is the NOTS test, which will let you identify and differentiate between true infections. So here in this picture, we have two different species, which can only be differentiated using this test. So on the right, we have Dirofilaria immitis, the true heartworm, and on the left, we have Acanthocylonema, which is a lookalike. So we recommend this test if you want to differentiate Dirofilaria immitis from the lookalike. And in that particular case, if you have Acanthocylonema, you'll have an antigen negative, but microfilaria positive. So again, recommend this test to demonstrate microfilaria in circulation, and the sample that you would send is blood. So just to summarize our dogs and cats, if you have GI parasites, start with a qualitative fecal float, and then use that information to treat, and then follow up after treatment by testing again in 2 weeks to ensure that your dewormer worked and the infection went away. And then if you are suspicious for zoonotic parasites like hookworms that are anthelmintic resistant, choose to use the quantitative fecal float. And then if you have Giardia suspicious cases, then you can use a zinc sulfate float or the antigen SNAP tests. Again, we offer those special tests like our lungworm, Behrman's, and fluke sedimentation tests. And if you do see adult parasites of any kind, you can send them to us for a parasite ID. So those are all the tests we offer, and I hope that was useful to select a parasitic test here at the KSVDL. Right.
Thank you, Jeba. That was outstanding practical information. Very, very useful. Do have some questions for you. One is, you mentioned that you will identify ticks and other mites and things like that. How do you want practitioners to send those into you?
So if you have 70% ethanol, that might be the best preservative medium. But if you don't have 70% ethanol, just put it in a blood tube, a red top tube, and just send it to us. If you're sending in mite samples, that might often be a skin scrape, so we recommend that you send those in mineral oil. You can put it on a slide, put a cover slip on top, put it in one of those little slide containers, and you can send them to us. Again, anything except formalin will work as a preservative. The only problem with formalin is that it fixes our samples, and then if we want to do any further diagnostics, we cannot use formalin fixed samples. So 70% ethanol if available, but otherwise no preservative and a red cap tube.
Very good. I noticed you mentioned using both a quantitative and qualitative test is appropriate. What would be the advantage of using both together?
So a quantitative test has only been validated in our large animals for Strongyle type eggs, and in our small animals only for hookworms. Eimeria interpretation is really hard, and so a quantitative test really is for Strongyle type eggs. Now, a qualitative test, though, will let you see other eggs that might be in there, including tapeworms, other types of Eimeria, whereas with a quantitative, we'll still report out Eimeria, but again, interpretation is difficult. So really for the wide variety of parasitic eggs that we might see, a qualitative is better. So often we see trichuris, but again, not in large enough numbers to be seen on a quantitative. So again, remember that the quantitative has a sensitivity of 10 eggs per gram. Anything less than that, we'll not see it there. But a qualitative has a sensitivity of 1 egg per gram, and we will see all sorts of parasites.
I know there's at least a couple entities on the bovine side that say that they can identify Strongyle eggs, speciate the Strongyle eggs. Are they using a different technology, or is that possible, or what's going on there?
Unfortunately, I don't know what technology they're using, but there is a clear consensus among experts that Strongyle type eggs, especially in food animals, have such overlapping lengths and widths that we cannot differentiate Haemonchus from Osteotagia. I know several entities say they can. I don't know how they do it, but in general, it's highly accepted that we cannot. The only way that you can get to that diagnosis is if you do a larval culture and you get to the L3 larvae. The larvae of Haemonchus and Osteotagia and Cupidia all look different, but without going to the larval stage, it is impossible to differentiate. And so if you have been using one of those labs, I would recommend that you ask them how it is that they're differentiating, because the consensus is that we cannot, which is also why we report out strongyle type eggs in our results, and that might be Haemonchus or Osteotagia, but all of them make very similar looking eggs. And same with the equine, where cytostomes and strongylus may all make the same kind of eggs, and so even there we say strongyle type eggs.
As you mentioned earlier, flukes in cattle are becoming a hot topic in the Midwest. And when I was in vet school, I believe I was taught that our tests for flukes were very insensitive. Is our technology better, or are they sensitive tests? Do we have confidence in a negative finding, or how does that work?
So the technology has slightly improved. So the sedimentation test we use can be sensitive depending on how many times it's done and how much feces we use to do the test. There is another test that we're developing here called the Fluke Finder, which is a validated test, but we are yet to offer it. So in that, it's a concentration technique, and that's the test we will use for our survey here coming up. So in the concentration technique, the performance is better. But the tests that are offered, if you have high suspicion for flukes, please retest again, because depending on the sample you send, that particular fraction may or may not have flukes or fluke eggs. And so sometimes you just have to repeat the test to ensure that you're getting the best diagnostics.
Another question is, how often do you see in your laboratory bovine lungworms from the Midwest submissions?
So we have seen one sample so far, and that came from the necropsy floor, and it was from Kansas. And so it is quite rare for bovines to have lungworms. So again, not very common here. It is more common in Europe, but at least in Kansas, we don't see it that often.
Well, thank you very much for your presentation today. And as Jeba mentioned, we don't really know what the fluke prevalence is in the Midwest, or certainly in Kansas. And so Jeba and Dr. Brian Herron will be starting a study to determine the prevalence. And so if you're contacted by our laboratory to submit samples from your herds, please participate. It's a question that we probably need to answer, and we just don't have the answer at this time. So keep looking out on the emails for an invitation to join our study. So with that, I don't think there's any more questions, Jeba. So again, appreciate it very, very much. It was outstanding information, and we'll see you all after the beginning of the year.